Respiratory infections are very common, and diagnosis of viruses such as influenza or RSV depends on collection of high-quality samples from the nasopharynx. To sample the nasopharynx, you'll need protective equipment including gloves and a mask. An N95 mask, eye protection, and disposable gown may be required depending on patient sampled and local infection guidelines. You will also need a lab requisition and either a nasopharyngeal swab kit or an aspiration kit. If using the swab kit, use the smaller, more flexible swab for the nasopharynx. Ensure the viral collection medium has not expired, as expired samples cannot be processed. Always wash your hands before starting, and wear gloves and a mask to protect yourself. Patients are virtually guaranteed to cough or sneeze during this procedure. Make sure you change your equipment between each patient as well. Explain the procedure to the patient, telling them they may cough or their eyes may water. Ask about a deviated septum, and get the patient to gently remove excess mucus from their nose. Estimate the distance by measuring from the corner of the nose to the tip of the ear. It is important to insert the swab only 1/2 to 2/3 this distance. With the patient seated and head tilted slightly back, insert the swab along the base of the nose and along the medial septum. If resistance is encountered, rotate the swab slightly or try the other nostril. When you reach your pre-measured distance, rotate the swab to dislodge epithelial cells before withdrawing it from the nose. Place the swab in the collection tube, snapping the end first. Label the tube with the patient's name and another unique identifier, as will be discussed shortly. Remember, the swab must be inserted straight back, parallel with the roof of the mouth. Do not insert the swab upwards. When finished, remove your mask and gloves and wash your hands thoroughly.